Well, good afternoon. Thank you for joining us for the Small Business Briefing. It is Monday, November 1st. I'm Rob Fowler, the CEO of the Small Business Association of Michigan. Brian Calley is here, and we're going to bring you the briefing today. This briefing is brought to you by Marana Group. Marana Group is a data, documents, and distribution services company, and they've been our underwriter from the very beginning of this briefing, and we really appreciate their support. Brian, when we last talked, there was a big football game coming, and that is now in the rearview mirror. Are you happy about the outcome?
You know, once I got past the tense part of that first quarter where the Spartans got behind by 10, and I was just determined. I was fortunate to be able to go to the game. And things weren't looking so good at first, and then, but I was resolved. I was going to stay for the whole game, no matter what happened. And I could not believe the whipsaw of the momentum changes back and forth. But also, I have never seen campus and East Lansing as full as what I saw on Saturday. Boy, people were out in force, and it was really nice to see. Obviously, the stadium was full, but really the whole town was full of people. And it was just, it was nice. Kind of felt like the old days.
Yeah, that's good stuff. All right, well, for people who watch this regularly, they will know that if it's Monday, we must be talking data. Again, just an opportunity for us to check in on what are the trends and what do they mean for small business. So let's take a look.
All right, I'm going to pull up the regular slideshow that we look at and just say that, you know, that unfortunately the numbers are kind of misbehaving this week. So we go back. This is, first of all, this is globally. So this is what's happening across the world. You see kind of a mini wave, and it crested, you know, kind of leveled off, and then has started to fall somewhat, but not falling. You know, some signs that it's not really falling like it did last summer. And so looking at the United States as a whole, you'll see, you know, pretty sharp fall from the peak, but also some signs that it might be leveling off a bit and at a higher level. And then here's what's happening in Michigan. So we talked last week about Michigan was had a peak. It was definitely starting to go down, but then if you look, let's take a look just at the last 90 days. And it's only reported 3 times a week. So that's why you see the tall bar graphs, but then the actual 7-day average is smoothed out, and you'll see that, you know, it's down. And then, you know, last week's numbers were a little higher than the week before, which was the first down week we'd seen in about 3 months. And so that is a, you know, so I guess it still kind of looks like we're at that crest or at that top. I was hoping we might see it go down more, but looking at hospitalizations, you know, leveling off, and so nothing new here. If you look at the hospitalization for just 90 days, you'll see, you know, it looks pretty flat there at the top. So it's matching what we see happening with infection curves. And I wanted to share, this is Minnesota. So we've been comparing ourselves to Minnesota the last couple of weeks. Does it look familiar? It looks, there's really just pretty remarkable how this wave looks very similar to what we see happening in Minnesota. So it's really a state I'm paying attention to, because it, you know, it looks like they always look like they're about, our trend is about a week behind their trend, and so theirs, you know, went down and back up again a little bit. So you know, all in all, you know, nothing that gives me great concern that, you know, our healthcare system is going to be overwhelmed anytime soon, but still with the positivity rate and the kind of mid-level, you know, mid-high level of cases, you know, if it took off from here, then you could see the healthcare system getting pretty strained. If it just hangs out in this place for a while, or you know, we're hoping to see it start to go down, then all the better. So it is, you know, just continuing this unusual place where we had a slow, gradual increase for 90 days, has leveled off. Looked like maybe it was coming down, and then last week, not so much. So I guess at this point, I'm going to still call it flat, and then we'll see. But little disappointing that this week did not show last week starting as a trend. It basically, down and then back up a little bit.
Brian, do you know off the top of your head or roughly what Michigan's vaccination rate is at this point?
Yeah, we have, depending on which age category you look at, we're well over 90% for those that are over age 65. We'll see some big change, and then as you get younger, the rate just continues to fall all the way down to those the youngest who are authorized from 8 to 12 or 12 to 18 is about 40%. So you kind of have a sliding scale up the age chart from there. And then that will change a bit here when we expect probably in a day or two, or 2 days, I guess, when 5 to 11-year-olds can start getting shots. There'll be plenty of those that happen. Generally speaking, if the parents get vaccinated, then their kids are much more likely to be vaccinated, and if not, then not. So you could see there being an overall population increase in terms of overall vaccination rate, but at this point, it really not much has changed in the last, say, couple months.
Yeah, and part of the reason I ask is, this idea of herd immunity, or when do we get back to sort of normal? And at least the aspiration has been that we get to 70% of the population is vaccinated. Although I think there's more and more we're hearing vaccinated and or naturally immune, having had the disease. I think if we put those two together, we're probably well over 70%. And I'm only making this point. Yeah, go ahead.
Yeah, I was just going to say that I think that the idea of herd immunity really comes from the mindset that the virus is someday going to go away, like it's going to be eradicated. And while it's generally more quietly talked about, there aren't very many epidemiologists left that even think that's in the ballpark of possible. And so what's more likely to happen is that this turns into just a virus that is with us for a long time. It'll continue to change, maybe forever. And but what'll happen is that the human immune system will continue to get more effective. And while it will continue to spread every year, it will be less serious with time. I think it's a more likely outcome, in which case this idea of herd immunity is something different. So what you're trying to do is get to a point where the population is not so seriously impacted by the spread of the disease as what it was when the hospitals were overcrowded. And that you see already, that's clearly happening. So we showed the hospitalization wave this time was a lot smaller than it was last time. And that has to do with the idea that, one of two things happening: immunity coming from vaccinations or from natural born infections. And you put those things together, and I think you're going to continue to see the serious illness decline over time, even though I'm not convinced that we're going to ever see the spread of the coronavirus wane over time. This idea of waves coming through our population, like I say, there's a lot of epidemiologists that believe that it's just really with us to stay. And by the way, before people are too hard on the United States, now we have way better health surveillance than most countries. So when you see the United States has more infections than anybody else, that has a lot to do with the fact that we have a healthcare system that identifies and tests more than a lot of countries around the world. And we're a very small part of the overall population of planet Earth. And so the idea that the trajectory globally of this virus is determined by what happens in the United States, not likely.
Right. Well, and I guess, same point can be made about Michigan relative to other states. Our state data is interesting, but you have to do all of this in that context. But here's my point. I think by a lot of counts, we're we're getting to a point in the pandemic where we may be just living with it. It'll be like a bad flu season, in some years, and vaccinations are available, and like the flu shot, people would be encouraged every year to get it. But we still have a public policy response that is pretty heavy-handed, and I use that to say this vaccine mandate that we've been talking about and we think is coming seems imminent at this point. What do we know about that?
Yeah, so we just heard this morning that the Federal Register will in the next couple days, it's definitely imminent. They said within days, the Labor Department's rule requiring private businesses with 100 or more employees to vaccinate or test weekly will be filed. And so the Office of Management and Budget in the White House, they had to do a review of it. That review is reportedly done. And so it will sometime very soon be filed. We still don't know exactly what the details are of this filing. They've sent some hints that they're going to be very stingy with religious exemptions. The stingier they get, the more vulnerable it is to legal challenge. But I also think that this is going to spur a lot of legal action based on whether or not the federal government has the ability to mandate this on private industry. I think they do on their own employees. I think that's pretty well established in law. Whether you agree with it or not, you might say that's not, the law shouldn't say that, but I think it is pretty well established in law that with the federal government's own employees that they can do this legally, and with their contractors is have this as a term of the contracts with the arrangements with their contractors. They're probably on pretty strong footing to do that. Where they're not on strong footing, and where I think that they're very vulnerable to legal challenges, applying this sort of requirement on private industry. And part of that is because it goes from a pandemic to an endemic. So pandemic being something is one big thing and then it goes away, to an endemic, which is just something that's with us every single year. The idea of having these sorts of emergency actions and pushing the envelope on government authority for something that is really moving past pandemic and into endemic status, I think it becomes more legally questionable every single day.
Well, and so I hear you, and I agree with you that they certainly have the right to require federal employees to have a vaccination. They can do that as the employer, probably their contractors. And in those cases, it's a vaccine mandate without a weekly testing option. In other words, it's get a vaccine or nothing, and it applies to part-time and full-time and remote employees. It doesn't give any off-ramp for those sort of things. Seems like this one might be a little different. At least reportedly, initially, there would be a weekly testing option. In other words, if I choose not to get the vaccine, I could test weekly to make certain that I don't have the coronavirus.
Yeah, and this is a legal strategy. I think if they wouldn't be offering the testing, the weekly testing as an option, if they felt they were on strong legal footing to do the vaccine mandate. So what they're trying to do is to say, well, it's not really a mandate because you can get testing weekly, but you can't as a practical matter, it does operate as a mandate because we do not have a system that can test millions more people who aren't sick. So we have a system that's set up to respond to people who are sick and getting tests when there's some reason to believe that they are. But the idea of saying across the board, everybody just get weekly tested if you're not vaccinated, that's a big enough part of our population that it would more than strain the system. And then you get into these questions about, well, when somebody gets tested, whose time are they on? It's already hard enough to hold on to employees. You can't keep people at work, or you can't keep enough of the hours full at work. And then you're going to take work hours and have people wait in line for testing. Even right now, some of the testing sites are 1 to 2 hour waits. So and then there's the other question of, Well, then testing and results to testing get backed up. And is it worth having slow results to tests, which is a public health risk in and of itself? So think about that. If you get a test, if it takes 2 or 3 days to come back, then that's 2 or 3 days. It's just weird thing. Like you'd think of people get tested, that maybe they would kind of slow their roll until they get until they get the test result back. But that's not really how it's turning out. I mean, people do change their behavior when they get a positive test. So the idea of extending out or taking days because it gets so backed up is another problem. And then you put on top of that all of the supply chain and logistical challenges that we face today. And so the parts, the components, before, remember the cotton swabs that they stick up your nose, that there was a shortage of those in the beginning. Okay, so maybe the increased production of those over the last year, but something as simple as packaging and transportation and distribution. There are huge shortages right now because of lack of truck drivers. So all of those same logistical problems will impact the testing. And that's why I think that the federal government's legal strategy of having a testing opt-out will not hold up as well in court as they thought it would a few months ago, before the federal government's own policies created all of these supply chain and inflationary pressures that we see around happening around the globe. So I think that the federal government's own policies may end up being something that trips them up on their testing out as a reason to say, well, it's not really a mandate, therefore we can do it.
So just maybe to be clear, we have been against mandates of most kinds. We'd certainly have been against this mandate. It wouldn't affect a large number of our members, but it would affect many. And so for that reason, we've joined with other business organizations and written and spoken out against this mandate. I just want to make sure everybody understands our sort of positioning on this one. Let's change subjects a little bit. The Unemployment Insurance Agency, was subject of a lot of fraud early on in the pandemic. People filing, for claims that they didn't deserve and under names that weren't theirs, and lots of shenanigans. We're starting to see some prosecution of those fraud cases. What should small businesses expect out of that?
So this is the first prosecution and guilty plea. 58 months is what this state contractor has pled to, and there are about $20 million in fraudulent claims that were enabled by this particular contractor. Word is that there's about 40 people who have been charged. So this is we're still on the front end of this, and it says that this person, Hawkins was her name, Hawkins' duties in her role in the state included reviewing, processing, and verifying the legitimacy of unemployment insurance claims. Between April and June of 2020, she would use her access to release payment on more than 700 claims, working with people filing fraudulent claims, sometimes using stolen identities. And so really the audacity of it is breathtaking. It's very, very disappointing that this sort of thing would happen. But on this scale, I mean, the scale of the fraud that moved through the system, and there were so many claims moving through. The decision was made at that time to reduce the number of verification steps, and it really did open the door for bad actors like this to do so. So the way that the scheme worked was that you have this network of fraudulent claims coming in. You have somebody whose job is to verify those that they're eligible, and so you have somebody that's in on it, verified all these fraudulent claims, and then gets a kickback on the payments that get made out from there. It's and the fact that here's one case of pleading to 58 months, and apparently 39 more right behind her.
Well, and the dynamic in this one has been perhaps a little different than most. If you had a group of state employees whose job was to oversee the expenditure of state dollars, that's one dynamic. But this is a case where we have a group of state employees whose job is to oversee an employer's fund. And when there was this kind of fraud and abuse that came through, it sort of begs the question, what's the remedy for that? It's unlikely that many of those dollars are going to be recovered. And so our advocacy has really turned to what is the remedy?
Yeah, and we've actually made some progress on this. You might recall throughout starting in 2020 and through 2021, while we don't do a lot of advocacy on the state budget, in other words, we don't go to the state and say, hey, spend money on this program or that program, in very limited circumstances, but usually we don't get involved in those. But we've been involved lately, and one of the things that we've asked for is for the state to replenish the unemployment insurance trust fund, which is 100% employer funded, to make up for these fraudulent claims that were paid out. And the message is, it is not the fault of employers that these fraudulent claims were paid out. Employers have nothing to do with approving claims in the fund, but employers have to pay for the fund. So what we had asked for were some, at least for the state portion, which the state portion is the part that's funded by local employers, where the feds, they sent some money as kind of passed through. There's a lot of fraud with that too, but we did our best to estimate what the fraudulent claims paid out, $150 million that were collected from employers, and said, state of Michigan, we think that you ought to take some of your general fund surplus, deposit into the trust fund, so that small businesses are not charged back on their rates to make up for these fraudulent claims. Now, it got in, and then it was vetoed, got it in again, it was vetoed again. There was kind of a saga back and forth. But finally, in the global deal of the budget that just went into effect on October 1st, there was $150 million for the unemployment insurance trust fund, and that deposit has now happened. So it was a long process. It takes a lot of patience sometimes to deal with this, but really kept at it. And thank you to all of our members that participated. We had calls to action on this in the past as well, to make sure that people knew that, it's one thing to extend benefits to a point where it makes it hard to find employees, but it was really insulting, this concept of paying out fraudulent claims and then billing back employers to make up for the deficit from that. So thankfully, at the end of the day, we got this one across the finish line.
Well, good. And I would say congratulations to you and sort of the other business community lead advocates for getting that done, staying with it. Another issue that we've been watching is in Washington, the so-called Build Back Better program or proposal coming from the Biden administration. And it's coupled with an infrastructure bill that is kind of hung up in the House now. And kind of what's the status of that? What would you expect to come this week?
So last week we saw a shift in language where they're trying to get an agreement, but the president had some traveling to do and speaking to at some summits and with other nation leaders on issues like climate change, as there's a big part of big agenda for climate change in this Build Back Better plan. And so he wanted to go there with something and couldn't get a deal across the board. So they came out with late last week on Thursday morning, a framework, not an agreement, framework, like a new framework that scaled back from the original $3.5 trillion to something smaller, 1.75 trillion. I thought I'd just go over the White House actually published a description of the framework. I've gone through that and kind of getting rid of all the fluff in terms of the nice words, and just getting what are the actual policies that they're looking to fund. Some of the big spending items include universal preschool. There's some additional child care subsidies tied to a percentage of income. So it's hard to say in these press release style descriptions exactly how it would be structured, but basically saying that most Americans any expense over 7% of your income that you would essentially get a credit for spent on childcare, but only for 6 and under. And then there's also expanding some home healthcare services, and which was one of the bigger line items. And then extending the child tax credit, which we've, many people are receiving $300 per child per month in right now through the end of the year. So included in that effort is to extend out that child tax credit payment. And then there is a series of items for climate change, and both incentivizing and then it's incentivizing the use of cleaner or renewable technology, and some regulatory framework to try to, kind of the carrot and stick approach both. The now one item though that I think would be of interest though is the earned income tax credit. There's one item on the expenditure side, but the way that these refundable tax credits, it's almost like, well, not almost, it's sending people money through the tax system. But the earned income tax credit that they're proposing to expand actually might not be a bad idea, because the way that this works is you have to have earned income, which means W-2 income, like you're actually working at a job. And if you work at a job and it's lower income, then you get a tax credit against that earned income. In other words, you get a subsidy for working. It's actually an incentive to work. Ronald Reagan was the first one who proposed this back in the 1980s. It's been part of our tax code for a long time. So, but there's an expansion of the Affordable Care Act and Medicaid, both to expand benefits in both of those programs, and then hearing benefits in Medicare. So those are the big expense items that are in the $1.75 trillion that they are proposing to spend.
There are a couple of things that are not in there that were initially that certainly come right in our direction.
Yeah. So on the victory side, first of all, it's been reduced some. We'd still rather see it reduced more, because it's the overall inflationary pressure from the federal spending is causing so many problems. But they've also apparently given up on 2 items. First is mandated leave. So you might recall that last week it looked like the negotiation was between 12 weeks and 4 weeks, but they have taken that off the table. That is not in the White House's framework description at all. So that looks like it's off the table, as well as the IRS spy scheme, and the getting transactions from everybody's bank account. And the thing about that, when it comes to for the IRS to say, hey, we want to look at everybody's bank account to make sure that you're not doing anything wrong, you're not managing your money in a way that's improper. The federal government has a $30 trillion debt. Like for them to say, hey, we got to check in on our taxpayers, make sure they're doing things right. It's just that's when hopefully that's not only stays in the rear view mirror, but it gets killed dead and never comes back. Now there are some things that on the payment side that I'm concerned about. So we've got some that wouldn't affect our members, at least not directly. They're looking to impose a 15% tax on corporate profits that would be kind of an alternative minimum tax to the existing tax code. We can get in a future show if that gets legs. We talk a little bit more about what that means. Kind of pushing the envelope on global profits. So a company does business overseas, to have a minimum 15% tax on what they're doing overseas, even if they pay taxes to a foreign government where they're operating. I think that'll have an impact on less money being reshored, less money coming back to the U.S., kind of an unintended consequence, but not unanticipated consequence to it. And then on those making over 10 and 25 million, some higher taxes as well. But the one that I'm concerned about, that I'm mainly concerned about for our members is the way they've described it. Invest in overhauling tax administration, and they say it's so that the wealthy finally pay what they owe. And the amount of investments into the IRS, that they expect the IRS to raise in addition to what they currently raise because of these investments in auditing, $400 billion.
Yeah.
So that's concerning.
That is, because that's coming right at small business. So many times when we talk, the feds in Washington, the IRS in particular, talk about something they term as the tax gap, meaning what's owed and what's paid. They really do have their sights set on small businesses, and that has been really apparent over the years. Hey, let's as we wrap up today, I just want to mention that there's an event next week. It is for our VIP and elite members. It's actually kind of an intimate forum to have an opportunity to meet with Congresspersons Upton and Dingell, one Republican, one Democrat. Should be a kind of cool opportunity to hear from them personally. And if you haven't heard about this, it may be because you're not a VIP or elite level member. Elite is actually a brand new membership category, Brian. We just introduced it, and it seems to be popular among those who are close to us, at least.
Yeah, and then this is like a true insiders kind of a membership. So our products and services with the memberships that most people have with us, that's all included. And this is really one that is aimed toward those that are really looking to engage in the public policy process at another level. And so we put together events for these members to engage closely. In this case, we're really excited about having Fred Upton and Debbie Dingell in, a Republican and Democrat, talk about these issues. They happen to be good personal friends. And so I think you'll see a dynamic that you don't normally see across the aisle at this one.
All right. That's what we have for you today. Actually, on Thursday, we'll have a guest talking about a MIOSHA fine that was leveled against actually what was a city, not a private business, and what they did to fight it and how it's turned out. We'll talk about that a little bit more on Thursday. I want to bring to your attention a webinar that we have coming tomorrow, which is what you should know about the employee retention tax credit. This is if you stayed open during the entire pandemic, if you didn't let employees go, you may want to take a look at this because it could be something that you can take advantage of. So tomorrow at 2 o'clock, what you should know about employee retention tax credit. Thanks for joining us today. We'll see you later in the week.
Hey, we'll see you all on Thursday.